Hello, my name is Lasasha Augustine, and today I'll be presenting to you the standards on therapy, which is broken down into three categories on my behalf. The first one will deal with 10.01, which is the informed consent to therapy. 10.02, therapy involving couples or families, and 10.03, which is group therapy. 10.01, which is the informed consent, pretty much deals with the document written in the oral consent that the psychologist gets from the client or the patient. And it pretty much states like the therapies, the fees, involvement of third parties, and the limits of confidentiality. And it's also important for the psychologist to express the consent in a language that is clear and easily to understand to the patient and the client. As early as feasible is pretty much used to indicate that obtaining informed consent during the first therapy session may not be possible or clinically appropriate for the patient or the client. Psychologists may need to wait for feedback from the client's or patient's HMO before a consent discussion regarding fees can be completed. If a patient is suicidal or undergoing some type of emergency crisis, this can actually contradict the informed consent process, so it's best to wait until the crisis has subsided and consent is obtained as soon as the information is provided for the psychologist. The nature of therapy deals with the information about therapeutic process that would reasonably be expected to affect clients or the patient's decision to enter into therapy with the psychologist. Informed consent should include the discussion of the duration of each session, which would be how long will it last, 50 minutes, 30 minutes, etc. The appointment schedule, will it be weekly, monthly, daily, and the general objective of treatment, which is trying to treat the crisis management, symptom reduction. Psychologists should inform client or patient on the type of therapy being received, which can include participating in biofeedback sessions, relaxation exercise, behavioral contracts, etc. Anticipated course of therapy deals with the number of expected sessions. Sessions are given based on the psychologist's knowledge of the client's or patient's presenting problems. Sessions are also given based on information from the company, institutional, or health plan policies of the client or patient. When doing the informed consent, psychologists must make sure that they include the fees for the therapy sessions for the client or patients, and it must include the cost of therapy, the types of reimbursement accepted by the psychologist, which you could be checks or credit card, debit cards, or even like a direct deposit from the health insurance, a payment schedule, which is it weekly or monthly. Also, they need to express when fees are reevaluated, which may be an annual raise in the rate, or policies regarding late payments and missed appointments. The involvement of third parties pretty much deals with those that will be involved in the therapy of the client or patient, and that includes legal guardians, health insurance companies, employers, organizations, and legal or other governing authorities. Confidentiality is very important in the informed consent process. Informed consent to therapy must provide a clear explanation of the extent and limit of confidentiality, including when psychologists must comply with reporting requirements or guardians' access of therapy involving minors or individuals with impaired consent capacity. Psychologists providing therapy and counseling to children and adolescents face unique informed consent tied to state and federal laws governing the rights and obligations of minors, anonymous health care decisions, laws related to the rights and obligations of minors and legal guardians, developmental change in the children's ability to understand their rights, the nature of their disorder, and the purpose of treatment. E-therapy has been described as a new modality for helping people resolve life and relationship issues from the comfort of their own homes. E-therapy allows for synchronous and asynchronous communication between the client and patient. Psychologists providing a web-based services should carefully consider the extent to which their services are considered established within the profession and whether their informed consent procedures need to comply with standard 10.01b, obtaining informed consent. 10.02 involves the therapy involving couples or families. In some couples or family treatment modalities, the client-patient is the multi-person unit, and the primary obligation of the psychologist is to the parties as a whole. Psychologists need to ensure that all family members understand the nature of psychotherapy and are voluntarily agreeing to participate. Clarifying the psychologist's role and the goals of therapy, and that includes the psychologist's responsibility in balancing the interests of different individuals, whether the psychologist will conduct individual or conjoint sessions, and how often the psychologist will meet with others, fidelity and responsibility. It's also important to note that the goals of treatment may differ from the individuals involved. With confidentiality, psychologists working with couples must take reasonable steps to clarify how confidentiality information will be handled. Psychologists must also clearly articulate their legal obligations and policies regarding confidentiality and disclosures of information about child abuse, domestic abuse, HIV notification, high-risk behaviors of adolescent client patients, other instances of potential harm. With group therapy, psychologists must describe at the outset of treatment the unique roles and responsibilities of both therapists and client patients in multi-purpose therapy. The discussion should include the differences between the therapist's attention in individual therapy compared to the group therapy. Group members also have responsibilities which include taking turns in the policies regarding such client-patient responsibilities. With confidentiality in group therapies, decisions made by members of a therapy group to disclose confidential information are neither bound by professional codes nor subject to legal liability. Psychologists can take reasonable steps to clarify that they request but not guarantee that all group members maintain the confidentiality of statements made during the sessions. Psychologists who see clients' patients concurrently in individual and group therapy must take special precautions to ensure that they do not inadvertently reveal during a group session confidential information gained about a client patient during an individual session. Psychologists must also clarify in advance to such clients differences between the goals, processes, and the therapy-client relationship in single versus group therapy. Once again, my name is Lasasha Augustine, and I hope you were able to get a little information on the standards of therapy. Thank you very much for your time.